Hello everyone, myself Dr. Neetu Modgil. I'm working as the ENT consultant in KIMS Secunderabad. So as we are facing the third wave of Omicron, so we would like to educate people about the Omicron, that we have already learned from the first and the second wave that the major area of contracting the disease is from the oral cavity, nose and eyes. So the foremost thing which we have learned in last 2 years is we do not have to touch this crucial area of the face, and we have to cover it with the mask. We cannot cover the eyes definitely, but we can cover our nose and mouth with the mask. We have to maintain the safe distance from the people around us, avoid populated areas, and definitely keep hand hygiene. Maintain hand hygiene as you have been doing in last few years, and maintain this habit for lifelong. Now, what is the difference between first, second waves and this third wave? People are vaccinated in this third wave. So most of the population has got the booster dose also. So what is the role of vaccine? Vaccine basically modify a disease. It means it makes the disease which is potentially lethal or aggressive to a mild symptoms. So what has happened? That many of the symptoms in third wave of Omicron are mild, and they are overlapping with the flu symptoms. Earlier we used to differentiate between normal flu and a COVID symptoms, like patients having high grade fever, patient having breathlessness, cough, and fogging of the thinking and headache, lot of headache. So these patients we used to differentiate by symptoms that they are most probably COVID. But these days, due to modification of the disease by vaccination, the mild symptoms are overlapping in lot of patients with the COVID symptoms. So we have to be careful just for the sake of population which is not yet vaccinated, and for the population which is still prone to develop high grade disease, for example, old age people, immunocompromised patients. So for the sake of population around us, for the safety of people around us, we have to maintain the isolation norms. So even the mild symptoms, you have to be careful about the isolation. You may not enter into ICU, you may not enter into aggressive or lethal disease, but it is our foremost priority to save other people around us. So now talking about ENT, patients who already had black fungus last year, they have to be little more careful. Though in this protocol of Omicron treatment, we have omitted the steroids. There were many factors leading to fungal infection last year in last wave. Maybe it was Delta wave, which was more aggressive for the sinus and the fungus to happen. Maybe it was humidified oxygen. Maybe it was steroid intake. There were multiple factors which are still under study, but this wave, we are not going to see the black fungus, and we definitely wish not to see and suffer the population with a black fungus, but definitely who had suffered last time, they have to be little more careful in this third wave. Patients with allergic rhinitis, patients with chronic sinusitis, patients with recurrent sore throat, they have to take extra care about them so that they do not miss the symptoms of COVID by considering it as a normal flu. So that's my take home message for the patients, that the patients who are having the regular sinuses, regular allergic rhinitis, nasal blockage, and had black fungus last time, they have to be a little more careful. The first thing that they have to do is, even if the symptoms are not going towards COVID, it is a mild symptom, regular symptoms, please get your RT-PCR done so that you can follow the isolation properly. Now, if the RT-PCR is positive, please consult by teleconsultation or by physical consultation to the doctor nearby. And if it is not, kindly visit your ENT doctor to take care of your nose, ear and throat in a proper way, so that it will heal properly without making yourself more prone to having the Omicron later. Thank you so much.